Hello, good evening, and welcome, ladies and gentlemen, to the MedCity's Facebook, YouTube, and Instagram live session tonight. So, once again, good evening to everyone, and as usual, I just would love to acknowledge people who are joining me from different parts of the world in order to be part of this evening session. Of course, Usha says, good evening, sir. Hi, good evening. Sham says, good evening, sir. Good evening to you, Sham. Namita says, hi, sir. Hello, hi, Namita. And a few more people. Someone asked me, when do we start? Of course, it always starts at 7. Okay, Reba Matthew says, good evening, sir. Reba, thank you. Good evening. Nice to see you in the session. Anaya David says, hi, sir. Good evening. Henna Sharma says, good evening. Watching from Kollam. So, thank you. Good. Anil Mohan is watching. A lot of people. Good to see most of the people who really join the session most of the time. AJ Jacob, hello, good evening. Thank you, good evening. Like maybe a little delay. Good to see most. Helma says, good evening, sir. Good evening to everybody. Right, of course. Okay, Jibin Joseph says good evening and watching. Jibin says good evening, sir. Good evening to all. Reshma says, okay, good evening, sir. Good evening. Like, okay, what are you going to talk about? Okay, Nika says, what are we going to talk about? Nika, thanks for the question. Of course, I'll definitely say what exactly the topic of today's discussion is. It's nothing but how to start different role plays in OET speaking. That's what we are going to talk about. All right. Good evening, sir. I am from MedCity column. All right. Arya Sara says, okay, thank you, Arya. Pavan Kumar says, hi, sir. How are you? Pavan, I'm really good. How about you people? Hope you're good. Divya Sanal says, good evening. Good evening. Anya David says, how are you, sir? I'm good. How are you? Good. Faith James says, good evening, sir. Good evening. Thank you so much. A lot of people, right? Okay. Still, Usha says, hi, sir, good evening. Fantastic. Good evening to everyone. So, I really want to say hi and good evening to everyone who is really joining for the session. All right. Okay. All right. Okay. A lot of people. Jesse says, a warm good evening to Johnny, sir, and to the whole team of MedCity Kannur. Jesse, Rachel, thank you so much. Right. Acknowledging the effort from the team of MedCity. Thank you, dear. Good, very much. All right. So there was a question, what exactly the topic of today's discussion? So as I said at the beginning, we are going to talk about, I just want all of you to have a look on the screen, what exactly we are going to talk about today. How to start different role plays in OET speaking. That's what exactly we are going to talk about the entire session. And okay, Rahna says good evening. Okay, waiting for your sessions to start. Of course, I have started now. Right. So how to start different role plays in OET speaking. And I don't think so we need actually a specific session to talk about, because there are a number of people who have really talked about different ways of starting different role plays. But when it comes in terms of assessment factors, because anything that is being said or anything that is being written in OET speaking or in writing, it's always being assessed on the basis of certain set factors. They're called assessment factors. So if you were to ask me, I would say, in order to start a perfect way or in an appropriate manner, if you want to really start the OET role play, the first thing is understanding the assessment factors. As I said, once you give justice or you do justice to the assessment factors, I don't really think that you need to worry about other things. So probably the most important thing is to understand assessment factors and how probably I can satisfy the beginning of a role play on par with the assessment factors. Okay, Aju says good evening. Sujala Jo says good evening. Janu Jacob says good evening, sir. Good evening to everyone. So before we start with, let me just give you a little clarity of the assessment factors. As you all know that there are two broader assessment factors, and the first one is called linguistic skill, which again has subcategories wherein we talk about intelligibility, fluency, appropriateness of language, and resources of grammar and expressions. Probably I would say that appropriateness of language counts in the case of starting a role play that we will discuss in little detail. All right, and understand the linguistic skills, intelligibility, fluency, appropriateness of language, and resources of grammar and expression. We will try to link the beginning of the role play and this at least one or two factors which comes under linguistic skills. All right. The other thing is called clinical communication skills, that is relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, information giving. So these are the two broader aspects based upon which an examiner assess you and give you the grade. Now you have seen two different things. One is actually linguistic skill. The other one is actually clinical communication skill. Now I have a question to all of you who are watching me. Can you just tell me which of these assessment factors directly evaluate your beginning of a role play? The question is simple. Which of these assessment factors directly evaluates the the beginning of your role play? So if you can type it, I would be grateful. So just think which of these assessment factors directly evaluates the beginning of the role play. If you can just try out and type your answers, I'll be pretty happy to see that. Just try that. Actually, it is relationship building, understanding and incorporating patient's perspective, providing structure, information gathering, information giving. Does any of this evaluate directly the beginning of the role play? If you can just think of, please type it. I'm just waiting to see your answers. Okay, right. Reba says relationship building. Absolutely, Reba. Exactly said it. So the relationship building is the one assessment factor which is directly related to the beginning of the role play. Absolutely. Great job. I think Reba is the only one who got it. Others can also think of. Maybe the answer is simply superb, and that's what. So let me just take you to that again. I want you to look at the screen. The question was this: which assessment factor normally evaluates the beginning of a role play? Straight away the answer is relationship building. Now if you look at relationship building, it has also like A1, A2, A3 and A4 segregated point, wherein the first one says initiating the interaction appropriately, which simply mean that how you start your role play. Now I want all of you to sync the beginning of the role play and how you satisfy the assessment factor. The question was this: which assessment factor normally evaluates the beginning of a role play? And the answer, it is simply to say that relationship building, one of the assessment factors which comes under clinical communication skill. Out of this relationship building, the first one itself is called initiating the interaction appropriately, which means what? You start your role play, you begin your role play. So if you want to get an excellent score in relationship building, you need to have the first point, starting your conversation appropriately, and that's what exactly I talked about today's discussion: how to start different role plays in OET speaking. When you have appropriate way of initiating, you have got a right start. And let me just take you to that point again. Look at The one element is relationship building. Out of that, the first one, initiating the interaction appropriately, which means you start, your conversation. So now let's understand what to be done when you initiate or when you begin the role play. So it simply says that just look at the screen. I have made the point what to be included when you do a proper or appropriate starting of your role play or beginning of your role play. The first thing says that greet the patient, introduce yourself, clarify the patient's name if necessary, clarify your role in their care, and nature of the interview can be explained or if necessary negotiated. Now I want all of you to just have a little more detailed understanding of how to start a perfect role play, which needs certain points. That is nothing but greet the patient, introduce yourself, clarify the patient's name if necessary, clarify your role in their care, and nature of the interview can be explained or if necessary negotiated. And of course, the first one is simply just you say either good evening or good afternoon or good morning according to the time of the test. And you introduce yourself by saying your name, and then you say that, what's exactly your job or your profile. And then you clarify the patient's name by asking how may I address you, may I know your name. But that also depends upon certain contexts or certain settings. Therefore, it's always clarify the patient's name if necessary, and clarify your role in their care, which is most important. Why are you there in that setting? Why have you gone there? Or what is the purpose that you are there? And then what are you going to do when you get that setting? So if you really want to start a perfect role play, please keep in mind you have to keep this point: a perfect greeting, a perfect introduction of yourself, and if necessary, clarify the patient name, clarify your role in their care, and nature of the interview can be explained or if necessary negotiated. I'm going to make clearly what exactly it does mean. All right. Now, if you want to really start a perfect role play, the first thing that you have to understand the settings and the scenario, because the last session, I just would love all of you to watch maybe the last live session wherein I talked about settings, scenarios, and its importance and how to use that 3 minutes of preparation. Now, if you want to initiate a proper conversation, the first thing that you have to understand the common settings and the scenarios, and everyone knows that. So the setting and scenario certainly affect the beginning of your role play. I just want all of you to just think about what I said. I made a statement. The setting and the scenario affect your beginning of the role play. How would it? If you look at the setting, if you look at the scenario, sometimes, right, you have patients who are already in the hospital, maybe a hospital ward, admitted. You see the actually new patient coming in, maybe a clinic or day clinic or a community health center, someone who comes for the first time. You see that existing patients wherein you make certain home visits to review the wound, or you go and talk to them about self-administration of insulin injection. This all indicate that either the patient is in the hospital, or the patient is new to us, or the patient who has been with us, or some or the other way related to us, existing. So you will have different patients based upon your setting and your scenario. So probably you will have an inpatient, you will have new patients, you will have existing patients. And not only that, if you have scenario and setting, you will have a prior knowledge of the name of the patient. See, I want you to look at the second statement. You will have prior knowledge of the patient's name. What does it mean? So based upon certain settings, you could say that oh, this patient is a non-patient, this patient is an unknown patient. And if there is a non-patient or unknown patient, you know whether to clarify their names or whether to start with their names. So if it is a non-patient, you could directly simply walk in and say, hello, good morning, Mr. Brown. So you would rather start your role play by greeting and calling out their name because it's a non-patient. If it is an unknown patient, you would rather ask, how may I address you? Right? Can I have your name, please? So you may get and clarify, or you would rather ask, can I have your name for record's sake? Right? For the purpose of recording or for the purpose of record. So you ask this and you clarify their names. So this is how I said the settings and scenario affect the way that you begin the role play, because according to settings, you can have the patients who are inpatient, who are new to you, who are existing patients, and therefore you have a chance to know the patient's name. You have the chance definitely unknown patients too. So this is how the scenario and setting affects. And let me just go and have a few words with you. What are the common scenarios? And probably in the last session I asked, and therefore I'm not going to ask again. Let me just show you that actually the common scenarios, the settings that we get it. Hospital ward, probably it's an let's say that post-operative ward, and the patient has been there. It's an inpatient wherein you are supposed to know the name of that patient. Maybe an intensive care unit, yes, you might know the name of the patient. Emergency department, you may not be knowing it. Outpatient clinic, you may not be knowing it. Day clinic, probably or may not be. Community health center, sometimes or certain scenarios you do not know the name of the patient. Home visits, sometimes and most of the time you do know the name of the patient because you are going with a particular purpose. General practice, sometimes you know it, you may not be knowing it. Nurse practitioner, sometimes. And school, of course, most of the time, if you are a nurse who is working in the school, you know it actually the name of the student. So probably this is how you need to understand based upon different settings and scenarios. Oh, I know the patient, I do not know the patient, because it affects the beginning of your role playing. So this is what I want to give you a generic idea or a general speaking. So now in order to begin the role play, you need to have certain things, and that is nothing but a proper greeting, then introduce yourself, then clarify the patient's name if necessary, clarify your role in their care, and nature of the interview can be explained or if necessary negotiated. So let me just take you to an active session now, and I'm going to give you a scenario here. As you can see here it is a hospital ward, and your 62-year-old patient is recovering from surgery she had yesterday to remove renal cyst. The operation went well, but she or he is still experiencing a lot of pain and is reluctant to withdraw from the IV morphine. You have come to counsel the patient on post-operative pain relief and medication control. And your first task, find out how the patient is feeling, right? Any changes in pain or any concerns. Now let me ask a question to all of you. Okay, there is a simple question here, simple to say that, do you know this patient or is the patient unknown to you? Can I just presumably say, yes, I am supposed to know the name of the patient? Nothing wrong in that, right? So this patient has been in the hospital for the last 2 days, and there's a great chance that that patient name is very much known to us, and your job is going there and counsel the patient. And I'm sure that if you can just tell me whether this patient is known or unknown, just look at the context, that means the settings, and then the scenario. Once again, I just want you to go there and Alright, Reba has come up with a suggestion. I think there is nothing wrong in if we ask the patient name again in case of non. Am I right? Okay, absolutely nothing wrong in that. Probably there's nothing wrong in that. That's what, like let's say that now the patient has been there in the hospital. So you could go and, like you might ask actually, for my confirmation's sake, can I have your name? Because you have a chart sheet or you have a case note and you have the name of the patient with you. Probably when you go to a real scenario, a hospital, you could absolutely ask, okay, because you have gone with actually particular set of medication to give, and instead of giving to the right person, you might give to a wrong person. So nothing wrong in that asking the name. I don't really say it's wrong. But probably when you have this context on an exam day, right, say hospital ward, do I need to know the patient name, or how possibly can I start here? So I want to look at all of you to this particular case which is given here. I want all of you to look at the desktop. Hospital ward. Your 62-year-old patient is recovering from surgery she had or he had yesterday to remove a renal cyst. The operation went well, but he or she is still experiencing a lot of pain and is reluctant to withdraw from the IV morphine. So you have come to counsel the patient on post-operative pain relief and medication control, and find out how the patient is feeling. And most of the people says, actually Suraj says it's a non-case, Jansi says it's a non-case, absolutely, Usha says it's a non-case. And if it is a non-case, you have 3 minutes preparation time wherein you can ask the interlocutor, all right, what can I call you during the session, or how may I address you during the role play, and then you can have a name beforehand, because this given context says that the patient is known to you and the lady or the man has been there in the hospital for last 2 days, and he or she has undergone surgery and now experiencing pain, reluctant to withdraw from IV morphine, and you have come to counsel the patient on post-operative pain relief and medication control. Now probably the first one is greeting. Maybe you can greet with the name, saying that good morning, good afternoon, according to the time. And then of course you could say that introduce yourself, because you have to do justice to this one. Greet the patient, introduce yourself. Maybe as Reba said, you can even again clarify the name if at all. Probably in this context not necessary at all. Clarify your role in their care, and that's what most important. What is your role when you went to that particular ward? And that's what I want all the students to pick it up. Now I know that we are all preparing ourselves for exam, and we have different kinds of people coming and teaching us, okay, this is the way you can start, this is the way that you can start. Nothing wrong in that, because at the end of the day, starting in a perfect way will land you correctly in the tasks. And if you start in a wrong way, it's so hard to come back to the task. So probably you need to understand what's my role, because the assessment factor says that clarify your role in their care. So you would say that, hey, I'm here to do this one, I'm here to do that one. So probably that is most important when you build your relationship building. What's your role? And I want all of you to pick up your role from here. Can anyone type that is your role in this context of speaking hospital ward, talking to the patient? Can anyone write your role as a nurse? I'm just waiting to see that your role. What is your role there? Right? So I'm waiting to have few answers. Most of the people said it's a non-case. Absolutely accepted, because the setting and the scenario says the patient has been in the hospital for last 2 days, and that simply indicates it's a non-patient. Now my question is, what is your role in this speaking or in the setting? Do you have a specific role? And I'm waiting to see, okay, giving sympathy and knowing what exactly the patient is going through. Faith James says that actually giving sympathy and knowing what exactly the patient is going through. Is that exactly your role? Probably I want all of you to look at and once again read the setting and identify what exactly your role. Good. James, it's good, but probably maybe a little detailed reading would definitely help you to crack at the right thing. Yeah, I want all of you to just see and what's your role there as a nurse to find how the patient is feeling. That's fine. Okay, that's one of the tasks, obvious. Okay, I am here to give you counsel and to know about your current situation. Exactly. Suraj Prakash says, I am here to counsel you, right, regarding post-operative pain relief and medication control. As a part of it, would you mind if I ask you a few questions? Good, exactly. Yes, Jancy Joseph says counseling the patient. You said it, dear. Exactly. And I want all of you to look at now. Please read again. Right? Your patient went through this. The operation went okay. The patient is experiencing. You have come to counsel the patient. So why are you there? What's your role there? So I'm sure that you're a registered nurse. I'm sure that. But why are you being sent there? Do you go there without a purpose? No. Every now and then when you go to a particular context or situation, you do have a purpose. Hey, I'm here to administrate and show how to do actually insulin injection by yourself. Hey, I'm here to discuss the discharge plan. Hey, I'm here to explain the blood transfusion procedure. I'm here to make you ready for chemotherapy. Of course, dears, you all have this particular role, and that's what actually saying that what's your role. And I think, okay, ensure that care we give as a team is having desired outcome. My dears, once again to everyone, please, when you got the setting, try to figure it out what's your job there, right? So that you can do it, like you can start perfectly. And this is a simple secrecy. Now let's say you need not go around so many things and having the confusion and all. You just go and say hello, good afternoon, or whatever it may be. You say that actually, and then you say that, okay, I'm a registered nurse and of course I'm here to do this one. All right, okay, is that okay if I ask you these questions? So probably you need to understand what the role you have. Now let's go to that one and see that. I want all of you to look at again. Now greet the patient with the name because it's a non-case. You can say, hello, good morning, Mr. Brown. I have just selected a name and you can say that my name's Maria David, one of the nurses on duty today, or you can simply say, I'm your attending nurse today. Right, you just introduce yourself. You said, hello, good morning, Mr. Brown. I just made an example to show that what exactly initiating appropriately, because the assessment factors says that I want all of you to look at, greet the patient, introduce yourself, if at all necessary, clarify the patient name if necessary, clarify your role in their care, and the nature of the interview can be explained. What are you going to do? Explain what you want to do, part of your role. Hey, I have come to counsel you. As part of that counseling, I want to do an interview here. So if you can link all these things together, I don't really think so that you need to worry about, should I really, like to have a different introduction for this one, to have a different introduction. It's simple to say that, think of actually greet the patient, introduce yourself, clarify the patient's name, clarify your role in the care. 99.9% of the time, students get confused with this one. But if you look at the setting, it is there. And nature of the interview can be explained or if necessary negotiated. We'll come into that picture a little more later. And now let me just take you to the one which I have shown you. Now let's say, hello, good morning, Mr. Brown. And my name is Maria David, one of the nurses on duty today. Or you could say that my name is Maria David, I'm your attending nurse today. So obviously he would say good afternoon or whatever it may be. And then you would say, hey, I'm here to counsel you on post-operative pain relief and medication control. Is that okay with you? So this is what exactly your role. Now you need to have this common sense here, because why should I need to say that? Because it is said by the assessment factor. It is not just said by the one who sits here. The assessment factor says that if you need to have an appropriate beginning, you need to know greeting, introduce yourself, clarify your role and say the nature of interview. You would say that, hey, I'm here to counsel you on post-operative pain relief and medication control. Is that okay with you? Or you could say, I'm here to talk about post-operative pain relief and medication control. Is that okay with you? So you just clarified your role, and then she said, oh, it's all perfectly fine. Then you say, thank you. Prior to that, I need to ask you a few questions regarding your pain. Would that be okay? Because if you look at the nature of interview is, of course, you have come to talk to her about, all right, counsel him or her about, like the pain management and the medication control. And as part of your role to teach or to talk about this medications and pain relief, you started to inquire the rest of the things, and that's called tasks. The nature of the interview is actually what I would love to know. How have you been with that? Because if you look at the role says actually, I'm sorry, let me just take you to that, the first one. It says actually find out how the patient is feeling. Now you just automatically drag yourself to the tasks, right? You are just falling to the task. You start with saying that, and you said introduce yourself, and then you said your role, and then I will say that what am I going to do that? What is the nature? Right, I'm here to find out how you're feeling now. But I came to counsel you regarding the pain management and medication control. And that's the role of me as a nurse in this context. Now, if you can do this one, I strongly believe that most of the time, students as well as the trainers could definitely teach the students, okay, this is how it should be done. Now, the question might be from everyone's side. Do I have the time for this one? Everyone asks this. Most of the time students do ask this. Do I have the time? And I would rather say, as I usually say, you are learning a method, or you are trying to incorporate a system wherein you know that anything that is learned systematically becomes very easy now. You talk about all mathematical equations. You talk about 2 2s are 4s, 2 3s are 6. So why do you start learning all this mathematics at the right young age? Because there is a system, there is a rhythm in it. And the same thing, if you start doing it and if you start practicing it again and again, I don't think that the time which I take will not be the same time which you would take later once you become an expert. Probably you would, fraction of seconds, you would just read it. Okay, come on. All right, my job is this. Okay, this is a non-case. All right, okay, I'm here to counsel. But as part of counseling, I am supposed to do this conversation. I am supposed to do this task. Now you understand, okay, I build up the relationship. And of course, I have taken one particular context, that is a hospital ward, and then I talked about, and I was just trying to, maybe you would have different style. I don't really say that you have to have, right, the same thing. I'm sorry. I won't really say that you have to copy paste what I have shown it on the screen. You could have your own ways. You could simply say, hello, good morning, Mr. Brown. And you would even rather ask, even say, right, how are you doing? Because it is at times, it is not even necessary to say that, like I'm a registered nurse and all. But why do we go with? Because I have heard it actually, some of the people, simply making a mockery of it. All right, why should I say registered nurse? Now, let me just tell you that actually, every person has got a particular design position, right? And that's the reason if someone comes into your house, he or she would say, I am so and so, I have this identity. It is just a protocol. It's just actually a formal style. That's it. It is not just because you might ask a question, why should I say I'm a registered nurse? Because every person knows that who is in the hospital, you are a nurse. But probably it is an assessment factor, and which says actually you can introduce yourself. And at times, probably being as an, with an inpatient, sometimes you may not even say, but if you were to ask me, I would say nothing wrong in that, because that's also part of assessment factor, right? Now imagine you might know the patient. Now let's say you were at the morning shift and someone is in the evening shifts, maybe going there. Probably you will be pretty comfortable with the name, as Reba said there, wherein we can again clarify. Right, you could come and say, am I speaking to this particular, or can I have your name for the sake of record or for confirmation? You can absolutely ask, nothing wrong in that. Having said that, probably you could think of actually just greet the person with the name because it's a non-case. Then you say that I'm so and so and I'm your attending nurse today. Make sure that your identity is revealed properly, and you can say that, hey Brown, I'm here to counsel you on post-operative pain relief and controlling medications. Is that okay if I go ahead with that? Or fine, go ahead. Okay, fine, fantastic. Okay, thank you, thank you, Brown. Prior to that, I need to ask you a few questions regarding your pain, because that's what your like what do you call assess, like that's what your tasks, wherein you're just slightly dropping into that. Maybe this could be one style, and I want you to take into one more thing, and please take up and see that it's a day clinic. Think of whether the patient is known or unknown. If you can just read and type it, please just read the setting here is a day clinic. This 52-year-old patient has recently returned to Australia after a year away. While overseas, he was involved in a traffic accident and suffered a head injury. Today, the doctor has diagnosed him or her with post-traumatic epilepsy and advised him or her to take medication to prevent further attacks, the doctor told the patient. And your task, sympathetically ask the patient how he or he has been feeling since the traffic accident. Now, I want all of you to just have a clear understanding of this setting and the scenario. And I want you to, like above everything, I just want you to pick what is your role, because it's a day clinic, and of course it is simple that you are a nurse on duty or you are a nurse working in this day clinic. There's no doubt that's your identification. That is done perfectly all right. Now just answer one question: is this patient known to you or unknown to you? That is one thing. Secondly, what is your role in this setting? And that's what I think all the students need to understand, the first thing, so that you could easily start, why do you want to have all this problem, like simply start, hey, how are you doing? And then he says, okay, I'm fine. Then I need to just sympathetically ask how he or she has been, like feeling since the traffic accident. So I just get actually in a kind of a clogged up, and I'm not able to move and sync properly. But if you understand what's your role here, that would be a great job. Right. So Suraj Prakash says unknown patient. Okay. Rubina says it's a non-patient. All right. Arav Vinit says non-case. Good. Now there's a challenge now. Now tell me, actually, it's a day clinic. Now understand that. All right. Non-case. All right. I want all of you to have a discussion here. Very good. Fantastic suggestion. Some of them said actually unknown patient. Some of them said actually non-patient. Okay. So when I say known and unknown, I don't really mean to say, actually, maybe in this context, when you say that known means so familiar with, right? And some of the people say known because I know the name. So maybe you need to have that intellectual evaluation now. Maybe I'm just trying to talk about a little more, right? So it's a day clinic. Probably you might know the patient, all right, by name, but not as an individual. So probably that is a challenge every student must be made aware of. And this is what it's not just a normal understanding of the setting. We need to have an in-depth understanding. Okay. Non-patient. Okay. Non-case. Okay. So Suraj says unknown case. Okay. So I want all of you to have a little discussion. What do you think about all of you? Right. Okay. Unknown case. Okay. Yashu Gaud says it's an unknown case. Okay. It is not necessary that you should know the patient, right? Is it necessary that I should know the patient? Not at all. All right. Absolutely. Okay. Priyanka Priya says non-patient. Not familiar. Nayana Raj says actually not familiar. That would be, like a beautiful, probably the best explanation. Okay, Usha says actually unknown patient. Okay, good contest. Now let's say, is it not a challenge actually? Let's say that actually we do a lot of practice, like, okay, unknown case, Needu says unknown case, not familiar. Doctor has already received the patient, so the nurse may know the name. All right, that could be absolutely one thing. Know the name. All right, okay, that's a good one. James says doctor has already received patient. Okay, reviewed patient. I'm sorry, the word is reviewed. Absolutely, because the setting says that actually. Right, okay. Okay, today the doctor has diagnosed him or her with post-traumatic epilepsy and advised him to take medication to help prevent further attacks. That's fine, good. So I'll come to James' suggestion because he has beautifully said it. The doctor has already reviewed the patient, so the nurses may know the name. That's it. Know the name. Probably I think this is the most beautiful explanation. So wherein at the beginning, Ms. Reba said it actually, we can clarify the name. Now this is actually, it's not an inpatient who has been there, but the patient walked to the hospital today or to the clinic today and the doctor did all those things, and finally, now you need to understand what's your role there. And when you link all this thing together only, you'll understand, do I really need to start with his name? Or do I need to, as Ms. Reba said, I need to clarify his name? Now the point, the judgment comes in such a detail. You might ask me, sir, is that so important? Yes, absolutely. If you have a great understanding, now let's say it's a day clinic. Fine. I'm coming with Mr. James' suggestion. James said it absolutely right. Right. He has been reviewed by the doctor today and the doctor diagnosed him with actually post-traumatic epilepsy, and probably, like the nurse should know it. Now you know that this is what the real context, that most of people are nurses. You know that actually the patient came and the doctor diagnosed him, and then finally the patient was sent to you or you were asked to meet that patient. Now you need to understand, do I know the patient as personally or do I know his name? I might know his name and I should know his name, because when the patient was referred to you or you are going to the patient, probably you have the case sheet as I said. And here I'm just bringing what exactly Ms. Reba suggested me. There is nothing wrong in actually, wherein you can ask the, that's what what they call the factor says that, look at here. Now look at this one. I want all of you to go. I'm sorry. I just, just give me a minute. Right. What was that? Right. Okay. Clarify maybe the assessment factors we talked about. This one. Clarify the patient's name. Right. So here, as Mr. James said, the doctor has reviewed the patient and the diagnosis was done, and this is being done. The doctor suggested or something. Now the nurse is walking up to the patient or the nurse is meeting the patient. Now what's your role? Now you might, okay, at their clinic, 1, 2, 3 people with the same name, and there you ask, can I have your name for confirmation's sake? And this is what a brilliant way of clarifying the patient's name. So when the assessment factors are created such a way, they have a purpose, right? So as I said, if you already know the name, there isn't much greatness in asking again that name. But here, that's a day clinic. As someone said, okay, I'm sorry, I forgot your name. Okay, all right, James again. Okay, someone said actually the patient, has come in. Probably you'll have all the details of it, and you're going to that patient, and you might see a lot of people there, and you might confirm with actually, hey, am I speaking to so and so person? Yes. All right. Can I have your name for client, or a confirmation sake? And therein you need to think of it this such a way. Right, it's a day clinic. Probably you know the names because there is a record as the doctor has reviewed him and diagnosed him. And therefore you can absolutely claim that the patient is not just because of name, but not familiar. Just leave it. Now, do I really need to start with his name, or do I need to clarify the name and then begin? And that's what a brilliant nurse would do that. Oh, right, okay, so fine, I'm sure that, can I have your name please for the confirmation sake? All right, okay, fine. Then you start your role there. Now that things we have discussed. Now let me ask a question. What's your role in this one? I just want all of you to understand I want all of you to talk about, I think this is the one exactly. I'm sorry. Did I miss the one? Okay. So what's your role here? Can anyone, suggest and help me up? So of course we talked about name. Okay. The nurse must know the name. Otherwise, no point of being a nurse. We can again clarify. Okay, fine. Now let's say Shanti Thomas says after examination of doctor, the nurse must know the name, otherwise no point of being a nurse. We can clarify again. All right, that's fine. Of course, Shanti says actually the name is known. There is nothing wrong in that because every patient who comes in, of course, there is a recordical, right? Every patient record must be done and you have a set of things, and probably if you turn the page, you might know the name. But the point is that you are going to a person and you are talking to a different one. And it's not just because maybe in a normal context we would say it is not necessary you can directly start with. But there's an assessment factor says that it is not said by someone who sits here. The assessment factor says that actually if necessary clarify. And probably that is even a little brilliancy, right? You just, the doctor asked you and you are going to meet actually. So now let's say a person is sitting there in the particular area. The doctor has done everything and now we are entering. And you might simply start with, by looking at maybe the case note, the record, you might say that actually, hello, all right, good afternoon, Mr. Brown or something. But probably you could confirm. Clarify the name and then start so that you would be talking to the right person. So in a way, we are trying to justify the assessment factor as well. And that's wherein we are trying to give and focus on assessment factors. So it is so simple to start a role play. But when you do with actually assessment factors, you are trying to encash the grade or the band that is assigned to that. And probably let's now, all right, ill effects. We have to convince him to take medications. Very good. Convincing the patient about the ill effects of IV morphine. All right. All right, let's say that. Good. To provide information about medications and further prevention. All right, a lot of people typing it. Good. Now, role of a nurse, a history collection. So someone says that actually history collection. Now, to provide information about medications and further preventions. Good. And advise him to take medication to prevent further attacks. Exactly. Right. Soumya says to provide information about medication and further prevention. I think you said it clearly. Your role is this. So the doctor diagnosed him. The doctor advised him. Now you are assigned to talk to him about the importance of continuously taking medication so that you can prevent further attacks. So you're there to talk to him about. As a part of that, you started to ask, how have you feeling since the accident? And this is maybe, it's so detailed that we have to go, because that's what the exact, the way of beginning the role play. Now let me just take you to that. So you could say that actually, good morning or good afternoon, of course, according to the time the test takes place. So most of the people do have a doubt whether should I use actually good morning and good afternoon. That's not a big concern. Maybe according to the time the test takes place. So you might say, my name's Maria and I'm one of the registered nurses in this facility. And for my confirmation, can you give your name, please? All right. So here I asked actually not just because I do not know his name. It is not that actually I'm insulting him. Rather, I'm making sure that I am talking to the right person because I have not seen him. He is being reviewed, or he has been reviewed by the doctor, and the doctor diagnosed him with actually post-traumatic epilepsy. And now your job, and the doctor wants you to talk to him about the importance of taking medications so that he could prevent further attack in future. My dears, this is what the role that you have in this context. Now tell me then, why have you gone there? You ask a question to yourself, why am I sent there? Why did the doctor ask me to meet him? Or why the doctor asked him to meet me as a nurse? Right? The simple context says that, hey, You are there to just talk to him about the importance of taking medications, and just tell him that if you continuously take medications, there is a chance of actually preventing further attack. And that's what exactly. Now you think of actually, this is what the real scenario of, like the OET speaking. People would say that you have to create a real scenario. And that's what different scenarios like with whom you are going to be in the real life. Now look at here. Why did I go there? Did I really come to actually check this patient is lying down there? Did I really come to talk about something else? No, I have come to talk to him about the doctor said that he should continuously take the medication. So therefore, clarify your role by saying that you say hello, good afternoon, good morning, whatever the time. Then you say, then obviously the patient would say, good afternoon, nurse. Then you could say, my name is Maria and I'm one of the registered nurses in this facility. All right. Or then you can say, for my confirmation, can I give you a name, please? So of course, then you say that, okay, thank you, Mr. Brown, or thank you, Mr. Alex, whatever things that you have. So thank you, Alex. I understand that you're diagnosed with a medical condition called post-traumatic epilepsy. So the doctor asked you to continue the medication. Is that right? Yeah, absolutely. Yes, fine. All right. Well, I'm here to talk about the importance of taking medication to prevent further attack. Is that okay with you? So you said your role. Then you start. That's how then they say the nature of the interview can be explained. Then you say, hey, I'm here to talk about the importance of medication taking and all. But as part of that, I would also love to know a few things, okay? All right. What is the thing that I would like to know? That is your task. That's your task. So this is how you build your relationship. You're not forcing yourself. You're actually smoothly falling to your task. So you would say that, hey, prior to that, hey, I'm here to talk about the importance of medication so that, you'll be able to prevent further attack. But prior to that, I would just like to ask you a few questions. Right. So look at actually maybe that explanation. Before that, would you mind if I ask a few things related to your condition since the accident? Because what is the task? The task says that sympathetically ask the patient how he or she has been feeling since the traffic accident. So now you say that, hey, I'm here to talk about because you're diagnosed with this and the doctor told you, and I am here to insist upon that so that you can prevent that. But as part of this counseling process, the nature of the thing, what I want to do is actually, I would also love to know a few things about, how have you been since the accident? So you automatically fall into that, the nature saying that, hey, the nature of the interview. What I want to do it as part of my role. My role is actually to talk about the importance of medications to prevent further attack, right? As part of that, the nature of the interview, what I want to do is this. What is that? Before that, would you mind if I ask a few things related to your condition since the accident? Certainly not. Please proceed. So you would definitely ask, can you just, or you can say, well, say the name actually saying, how have you been feeling since that the accident? Then he would say that, okay, I've been feeling this, or I have had this episodes. I don't know. Maybe you need to look at the rest of the tasks. So you build a relationship, you automatically and gradually fall into that. So please do understand that your role in the OET speaking is very, very important. So when you start doing it, what are you trying to do that? You're trying to justify the assessment factors. And that's what the only thing I want to say, that if you want to start a better way, the first thing, actually greet the patient, introduce yourself, clarify the patient names if necessary. Of course, at their clinic, there could be many people coming in, and you have a chance to meet 1, 2, 3 people with the same name. Probably it's great, and that's what the assessment factor put it actually. Clarify the patient's name if necessary. What does it mean? Does it mean that the patient who comes into the clinic or hospital does not have a name? They all have name. So if you know that, we know everyone's name. But it is our simple common sense to go and confirm and say, are you the same person? Because for the first time I am meeting you. But let's say that if I'm going to a hospital ward, I'm almost sure that I have had the acquaintance with him for the last couple of days. So probably I would say, hello, good morning, Margaret. All right, because she has been with me for last couple of days, right? Wherein I won't even say that I'm a registered nurse. You could simply say sometimes. So this is what, like knowing the name, and whether should I start with the name, whether should I clarify the name. The clarifying the name, why it's being included in assessment factors, to check it whether do you really understand this difference. And that's the reason, if you really want to build and begin a role play in a better way, of course you need to do justice to the simple thing that is called assessment factors, which directly says that you need to have all these elements. Initiate the interaction appropriately, which includes the perfect greeting, introduce yourself necessary, clarify the patient's name, clarify your role in their care. This is not just like created by MedCity and just put it on. It is not said by. It is exactly the assessment factors, which is actually a public version. Everyone can have a look on it. What do they mean by clarifying your role in their care? Oh, here I am here to advise that. Okay, I'm here to demonstrate. Oh, I'm here to talk about that. But as part of that, this is what I want to do it. That's called nature of interview. So if necessary, negotiated, which means if someone comes to you, you could also ask what brings you here today, or how may I help you today. And that's what negotiating the purpose of the interview for which they have come in. So the patient comes in and you would say that what brings you here today. Then that is also a nature of interview, because precisely it is actually an unknown and it's a new scenario. So you could absolutely say, I don't have a plan to talk to him, because it's actually it's something that is very new and I don't know the patient. And you would definitely ask, what brings you here today? So this is what, if necessary, negotiate the nature. So I am here to talk about my father. Oh, then you start doing it. Okay, the nature of interview gonna be actually the discussion about the father and how to control his diabetes and how to do exercise and how to do diet systems. Oh yes, the nature of interviews turned into actually discussion regarding his father. So probably that is called, if necessary, negotiating. And of course that takes me to the end. I think it's too long. Probably I was just trying to talk about one simple thing. There could be different scenarios, but greet the patient, introduce yourself, clarify the patient's name, clarify your role in the care. That's most important. And possibly, if you can say nature of interview, not possibly, that's one of the assessment factors which is precisely said it and asked from you as a student. All right, once again, let me just tell you that there are so many things that is like at your fingertips, and one of them is MedCity's OET app. Probably I always say that like a lot of business